Welcome back to our series on helping patients recover after they've had surgery for mastectomies or lumpectomies or biopsies even. This whole series is here to help you recover and know what you can do after you've had surgery. So today we're looking at those very early days. So you've woken up after surgery and you're wondering, what can you do to help yourself? So this is what we call day 0 to 3. So Alex is with me today. Thank you, Alex, for helping us out today. If you want to tell them just a tiny little bit of which side you've had your surgery on and how long it is now since you've recovered, just so they can see they're not comparing day 0 to where we're at now.
About 5 years post-surgery, I had it on the left breast and I had a kind of like a wide local incision, so slightly bigger than the lumpectomy.
Great. So if you're not moving as good as Alex is moving today, don't panic. Alex is down the road a little bit and we're very grateful for us sharing her story today and helping us out. So when we wake up after surgery, the first thing to think about is, can you move? Because sometimes, depending on what's happened, there's drains and there's plugs and there's wires coming out of you. So don't panic. And with all of this, the first protocol is your nurses and your consultants. And you can check with them what it is that you're able to do. Our golden rule throughout our video series is if you're in any doubt, you ask and you get it checked out. Alright, so what we're showing you here is the guidelines from the American Cancer Society about what you can do post-op. But everyone is different, so you must ask the professionals around you if you're in any doubt. So the first thing we think about is positioning. So the recommendation is that for 45 minutes, you lay with your arm in a position above your heart. And you try and do 3 sessions of that a day. So what does that look like? First one is, Alex, if I get you to lie down. And you can head facing the ceiling. Head down on the pillow, and Alex's was her left arm, so I'm going to show you here on the left arm. So you can do this in hospital or at home. You just need to get your hands on some pillows. So you just pop the pillow across your waist, and then you take the arm on the operated side and you rest it nice and supported, simply like that. Now I would also tend to stick a little pillow under your knees, just so that you're not putting too much pressure on your back. So step 1 is as simple as this. Now, if you don't like being down that flat on the beautiful hospital beds, you can bring yourself up a little bit, or at home you can just use some pillows behind you, because it can be uncomfortable post-surgery to lie completely flat like that. So don't be afraid to lift the head of the bed up, because with the arm under the pillow, it's still higher than your heart. So that's not hard to do as a first exercise, to keep that hand up to help reduce the swelling. Now, I would suggest that you combine this 45 minutes with the key exercises for days 0, 1, 2 and 3, and we're going to go through them now. The first thing is to think about your hand. When we wake up after surgery, I hear time and time again the word fear. Fear of movement, fear of hurting it, fear of tearing something, fear of ripping something. It's fear that's overwhelming everyone to move. But the reality is, from day 1 post-op, you can use that arm for normal activity. And that starts with the hand. So with this exercise, the first thing that we're going to do is make a fist and then relax. So in that position, Alex, you're just going to squeeze that fist and then open it. And you're going to count 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, and last one, 15. 15 times with your fist, just closing and opening. And then you go to the next part, which is your wrist. For this one, all you're going to do is lift the hand up and back down on the pillow. Off you go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Not so bad so far, right? Manageable? So, yeah, exactly, you can feel it working. And actually that's a good point with Alex. So we're sitting here, Alex obviously hasn't had her surgery today. Yes, you're going to feel a little bit of discomfort when you're doing these, but it should not feel painful. It will feel like hard work, you'll feel like you've got tired. The key thing is you listen to your body, you do what you feel that you can, and if you're in any pain, you stop. So yes, it should feel like it's stretching, even aching, but not painful. The third one then, so we've done our fist and our wrist, is to concentrate on our elbow. So day 0 to 3, we're not asking anything major of the shoulder, it's just this lower arm we're working on. And for this one, Alex, all you're going to do is turn the hand around and then place it back down again. Okay, off you go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. And say Alex got to number 8 there and she started to feel it pulling and getting uncomfortable in her arm, she'd just stop there and she'd come back to this exercise later on. So yes, the target is around 15 if you feel comfortable, but if you get any discomfort before that, you just stop. Last one now on the elbow, and this is a little bit more tricky if you've got cannulas and tubes going on, but you just do what you can. What you're going to do is straighten out that elbow and then bend it as far as you feel that you can, keeping that arm up over the heart. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13. Last 2, keep it going. 14. And last 1. 15. And relax. What did you feel there, Alex?
About halfway through my arm surgery, really feel like I was working hard.
Okay, so halfway through she started to feel hard. Any pain?
No pain.
No pain.
Right.
So no pain, starting to work hard, you keep going to 15. Now again, in the days post-surgery, this might seem like the most daunting thing in the world. The key message here is that it's okay to move. You just do what your body feels it can. So if, for example, Alex started getting pain, then a simple suggestion is don't go through the full way. So just bend, straighten and bend as far as you feel that you can. So you might do half of the movement 15 times and then relax it down. And that's okay as well. You do as much as you feel you can. Your body will tell you when enough is enough. Okay? So we're still in this position because we want to do it for 45 minutes 3 times a day. And now Alex has completed all of those key exercises for days 0 to 3. The last part in this position is to think about filling those lungs. Deep breathing. Now, after you've had surgery on this side, it can feel very frightening to actually fill your lungs. You'll feel like you're pushing out against that scar. But actually that's exactly what we need to do, very gently, to get the tissue used to that movement so that you don't end up rounding those shoulders and coming into that rounded shoulder posture that you hear people talking about after they've had their breast surgery, where you end up coming into this protective position. If we start deep breathing from early on, we're going to open up those lungs and take that fear away from that stretch on the front of the chest. So again, you're in this position, your arm is still elevated to help with that swelling, and you're going to talk yourself through some deep breathing. So we're going to just concentrate on 5 deep breaths. You're going to fill up those lungs, taking in as much air as you can. I want you to think about your tummy coming up towards the ceiling, really filling those lungs. So nice and gentle. You're going to take 1 big deep breath in for me. Fill up those lungs, tummy comes up, and relax it down. That's 1, and we can see Alex's chest rise as she's doing it. And again, deep breath in, tummy comes up, fill those lungs, and relax it down. That's 2. Off, 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 and relax it down. Now after 3, you might break for a second. If you feel any lightheadedness here, you need to stop. Any headaches building, anything like that, you need to stop. So this is all should be comfortable and controlled. Sometimes doing 5 in a row can be a bit much, and it would send anyone a bit lightheaded. So you do 3, take a break, some nice normal small breaths, and then 2 more when you're ready. And let it go. And last one. Deep breath in, fill in those lungs, and let it go, let it go, let it go, and relax. How did that feel? Okay? So again, you might feel a bit apprehensive about doing that if you've got some post-surgery scarring on that side, or even the padding that can be on afterwards. You just do what you feel you can. That's the message. Your body will tell you when to stop. So that is what we do in those first few days. So just to recap, positioning is key. Keep that hand above the heart for 45 minutes, 3 times a day, using pillows to help with the swelling. And then your exercises, you think about opening and closing the fist, wrist goes up and down, hand round and down, and then that elbow, straightening and bending. And then finish your session with 5 deep breaths, filling up those lungs. And that will take you through day 0, 1, 2 and 3. To follow on to our next video, we'll tell you what to do from then on. But remember, if you're in any doubt or something doesn't feel comfortable, you get it checked out with your healthcare professional or your consultant.